California continues to lead. As of today, we have the lowest positivity rate in America, 3.3%. As of today, you look at the 7-day case rate, we have the 6th lowest 7-day case rate in America. We continue to lead the nation in terms of administered doses of vaccine, and we continue to do more than most other states in promoting not only the safety and efficacy of our vaccines, but promoting the boosters, which we'll talk about here in a moment, and promoting the critical nature and importance of getting those, particularly 5 and 11, vaccinated as well, so we can continue our nation-leading efforts to keep our kids safely in person in school for the rest of the school year. More on that as well in a moment. That said, we are here mindful of what's occurring not just in the state of California, across this country, but around the rest of the globe, and that's this new variant. It is not lost on me that it was just a few weeks ago that Dr. Galley, who's here, and I were in Winton, California, in the Central Valley, announcing the first identified Omicron variant case in the nation. Here we are now, 48 states. Let's disabuse ourselves. All 50 states have the variant, 48 that are publicly described as having it. 191 individuals, just 191 individuals formally we have identified with the variant in this state, but we know what you know, and that is the ubiquity of this variant is now taking over the Delta and presents itself all across this state and this nation. How do we know that? It's not just anecdotal. We know that because we trace and track the variant, notably through wastewater assessments that are done every day. Those assessments and that tracking, including the genomics that is done, second to none in this state compared to any other state, we now are tracking well north of 50% of all of the sequenced genomes identifying themselves as Omicron. In fact, tomorrow we will come out with an updated number, a bit of a preview Thursday. When we update that number, you noted that 73% have been identified across this nation. We have conservatively identified over 50%. We know it's well north of that, and that will be disclosed tomorrow when that data is put together in aggregate form and will be shared publicly. We're here as well, as the supervisor noted and the senator noted, because we've seen a significant increase in the number of identified cases of COVID. I'll put it in perspective. That's rather simple to understand. This time last week, we were at 2.3% positivity. Today, we're at 3.3% positivity. They may not seem significant, but in percentage terms, that's a big increase in just 1 week. Last week, we had 5,400 cases identified. Today, just shy of 11,000 cases of COVID identified. So almost a doubling of cases in 1 week, and a positivity rate that increased substantially from 2.3 to 3.3%. So you can do the math on this and get a sense of the challenge that we all face here in the state, country, and around the rest of the world. We continue to believe in the absence of contrary data, though there is some conflicting data, that not only is the Omicron variant more transmissible, but it seems for those that have been vaccinated, and particularly those that have been boosted, to be substantially less severe than the Delta variant. But the caveat is for those that have been vaccinated, and in particular those that have been boosted. And so our goal is to continue to get people vaccinated. The most important shot remains that first shot, and then the most important shot for those that have received at least the J&J vaccine or 2 doses of the Pfizer or Moderna is to get boosted. It is increasingly clear, though it's not formalized, and we are not at this stage formalizing it in the state of California, that the full dosing is a 3rd dose. And that's why the booster is so important, and we're here to promote our boosting efforts here in the state of California. 8.7 million Californians have received at least a dose of the booster. We need to increase that number if we're going to hold the line and decrease the growth for hospitals and our ICUs. We're roughly about 3,600, just shy of 3,600 people hospitalized today. I'll remind you that January 6th of last year, or rather this year, we had just shy of 22,000 people hospitalized. 22,000, roughly 3,600 within a period of just a few weeks of where we're standing today compared to last year. So we're holding strong, mindful, though, of these growth rates and these trends. And so we can't take anything for granted. And we're here to promote not just boosters, promote new strategies, 3 specifically that we wanted to discuss briefly here today. Number 1, nothing more important when we're experiencing a surge in growth of case rates than protecting our frontline heroes and employees. And that's why we led, as the first state in the nation, to require all healthcare workers to be vaccinated. And we're really proud of those partnerships, our providers, remarkable support we received from organized labor as well as community clinics, not just our hospitals, that supported that effort. And that led to extraordinarily high vaccination rates for our healthcare workers, kept staff working, kept the morale strong, kept their immunity strong. But we recognize now that just being vaccinated, fully vaccinated, is not enough with this new variant, and we believe it's important to extend this requirement to getting that 3rd dose, to getting boosted. And so we are formalizing that. February 1st is the deadline to get that done. And I again want to just thank all our partners. We worked hard to get feedback and to organize this framework for their broad support in this space. I think it is a smart move. I think it's the wise move in this context that we need to make sure we don't have staffing shortages. We need to keep all of you healthy and safe. And again, the best way to do that is to get boosted. By the way, for those that wondered why we put out an executive order a few weeks ago, we did it in anticipation of this moment. We created some waivers, some flexibilities for our hospital system and our provider network, some decompression strategies, but we also allowed for contracted staff. We have 1,700 contracted staff in the state of California already to prepare for this increase. We have 500 more individuals that we have secured that are not yet into the state of California, and they're supporting 120 providers in the state. That was one of the purposes of extending that executive order. Again, all in an effort to prepare, not react, but to prepare for the moment we're in and the moments that present themselves in the very near future. We also believe that our most important agenda must be to continue our nation-leading efforts to keep our kids in school. And I just think it's an important point. Not only do we have 53% less deaths, and I appreciate, Senator, your reference to death rates than places like Florida, but Florida is not keeping their kids in schools because many of them are shutting down because of outbreaks like the state of California. I don't highlight that to pick on Florida, but there's a sort of meta message that utilizes the Florida example as the more appropriate example. But if you believe that deaths matter, you believe that pediatric hospitalizations are of concern, and you believe that shutting down schools is suboptimal, then you may want to look at the approach states like California have taken. And that's why I was very pleased that we put out a statement today from all of our school partners, from superintendents to teachers to those representing our janitors, our bus drivers, unanimously came out with a statement today affirming our commitment to keep our kids in-person instruction and to keep our schools open. I do not want to see our schools shut down. And I'm very grateful that all of our partners in education put out a statement amplifying that message so that there be no doubt. That is our commitment, that is our priority, and in order to advance that priority, we are committing to the second point that I wanted to highlight of the 3 today, and that is after our kids have enjoyed the holidays with family, friends, safely, we hope, traveling in many cases. We want to make sure they come back in as good a shape as they left, meaning we want to make sure that we are testing our kids and preparing them to come back in-person instruction. So we'll be sending out, we are ordering 6 million tests, no charge, and we're going to be sending those out to our partners all up and down the state to allow for priority access for at least 1 to 2 tests before our kids come back into school, so they have access to antigen tests and or PCR tests, but primarily antigen tests, so that they can get those results back quickly and make sure when they go back into person, they're doing so safely, knowing that they have not contracted the disease over the holidays. So that's the second announcement we're advancing here today. Number 3, we want to extend hours of operation for our nation-leading testing efforts. Let me be more specific. Based upon the federal government's own assessment, 20 or so thousand testing sites exist in the United States. We know for a fact California has 6,288, which puts us a little over 30% of all of America's testing sites are operational here in the state of California. That's why you're not seeing the long lines necessarily in around blocks like other cities and states, because we have access that's quite ubiquitous. In fact, we've been able to determine that 90% of Californians, and remember this is a state larger than 21 state populations combined, a lot of rural and remote parts of the state, 90% of California residents have access to a testing site that is within 30 minutes of their home, 60% within just 15 minutes of their home. We have 257 OptumServe partners, and we are working with them to extend the hours of operation, to expand them, particularly where there is high demand and there's some bottlenecks. And we're assessing that and working in real time. So we're also looking to expand the hours of operation to provide more access to testing in this state. I noted that we're going to be purchasing 6 million new tests for our kids. That builds on what we've done since August 21st. Where the state has procured 12 million tests, providing them to community-based organizations like this, clinics large and small, hospitals, schools, and local health departments in this state. And that's just highlighting the fact, again, we're not reacting to, we've been leaning in on this testing frame. So, look, I recognize, as I've had family members that say, boy, I was just down at the Walgreens and CVS, they were out of the over-the-counter. I reminded them, they go to My Turn, just Google My Turn, you will have a list that is proximate to your home availability for free testing. And you can learn about testing exists here, and testing exists throughout the state of California, if indeed the supply chains at the pharmacies and retail are a little bit behind, that you'll still avail yourself and have the opportunity to access that testing. I just want to remind people of that. And not many, not a lot of us can afford those tests at Walgreens or Safeway and the like. And so, again, My Turn has culturally competent information, many different languages. You can actually access not only locations, but you also can make an appointment on that platform as well. If you need more information, you go to the covid19.ca.gov website. That ca.gov confuses everybody. If you just Google My Turn, I think you'll at least have the access that provides at least baseline information that will help you on the way. So those are the 3 announcements here today. Get that third shot, get that full complement of vaccines for healthcare workers and nursing home staff to make sure that we are prepared to get our kids back in school. 0.3%, by the way, 0.3, that's 0.3% of the nation's school closures, even though we have 12% of the nation's student population. There's been 9,600 schools that have shut down in America, just 32 in the nation's most populous state. Because we've led with health. We've led with vaccination efforts, and we're leading with masking, as the senator said, which is so critical as well as the most important non-pharmaceutical intervention we can advance besides common sense in terms of addressing this virus. So again, as I am often prone to be long-winded, forgive me, but this is important to share this information, and I'll just close, as I often do, reflecting back in the last year and a half. The one word is humility. We don't know what we don't know. Humility. Can't be ideological. Must be open to evidence, argument, and be willing to iterate in real time. And so I'm mindful at this moment, with the nation's lowest positivity rates, the 6th lowest case rates, that can change in a matter of days, not just weeks or months. And at the end of the day, nothing we do here at the state or even in Alameda County, which is doing an extraordinary job, matters compared to what you do and the decisions you make at home. And so I want to remind everybody of the power and potency of your day-to-day decisions in terms of our fate collectively and our future as it relates to this virus. And remind people to be safe, to spend time with their loved ones, but to do so thoughtfully, considering what we're facing and knowing of our resilience and our capacity and resolve to get this behind us. We will get this behind us. I know you're exhausted. We're all exhausted by this. But we have something we never had in the past, and that's the power of these life-saving vaccines and the power to get boosted to get through this arguably 5th wave of this pandemic and get closer to that day where this pandemic becomes an endemic and we manage it as we manage so many issues in our state, in the world we're living in. So that, we're here to answer any questions.
Question in the back, and the mic. Yeah, go for it.
Governor, thank you for visiting today. My name is Keith Burbank. I'm with Bay City News. I was wondering, could you just comment, or I'm wondering if the requirement for the booster for healthcare workers is too restrictive, and what would you tell healthcare workers that are, kind of on the fence in terms of getting a booster? Please.
I tell them, first of all, thank you for their extraordinary sacrifice. The burnout rate for our healthcare workers is off the charts. I can't tell you how many remarkable healthcare workers I've met who talk about not being able to unsee what they see. And that takes a toll. To be there where no other loved ones could be there at the last breath of someone they're trying to save because of the contagiousness of their condition, and being there for those individuals and taking their own iPads to do FaceTime to allow someone to say their final words. It's on a ventilator to their loved ones. And so, number one, I'd say thank you. Number two, I also want to extend appreciation for the fact that when we were the first state in the country to require this vaccination mandate, that overwhelming majority of them complied. And as a consequence, we are outperforming in terms of the number of staff, critical staff, that's actually able to continue to do their extraordinary life-saving work every single day, meaning they're not dialing in sick because their immune system has been boosted because of the vaccines. And then finally, I just remind them, let's not run the 90-yard dash. The data is overwhelming, it's clear, evidence is in, 2 doses is great, the booster is a game changer, and that 3rd dose is needed. And no group of workers understands that perhaps more than our frontline healthcare workers. And so I would just ask them to continue to lead by example as they have, and thank them for that example and modeling good behavior.
Thank you.
Thank you.
Governor Liz Tree with KTRA out of Sacramento. What are you going to do about school districts that say they refuse to require the vaccine of their students, or even school districts like Sacramento City Unified that's requiring it early but has seen really low vaccination rates among its students?
Well, I continue to work with school districts, large and small. I'm grateful and pleased with the overwhelming majority. I don't consume myself with the exceptions, the extremes. But the overwhelming majority that are not only in compliance, but are working as partners to provide insight and to support accountability and transparency in terms of keeping their kids safe and in person. I'd also remind them that many of these districts that don't like the vaccine mandate that they require vaccine, and they are mandated, those same districts and those same leaders, for 10 other vaccinations. And I want to thank them for their high compliance rates for measles, mumps, whooping cough, and other things, and encourage them to consider 11th. We'll wait till the FDA fully approves it, and then it goes into effect. So it's not in effect right now. We provide common sense exemptions, medical exemptions, religious exemptions. Currently, there's a personal belief exemption, but again, it's not even in effect. Some have decided to move forward earlier. Some have decided to modify that. LA Unified is an example. And I want to just express appreciation for recognizing local conditions. There's 1,050 or so school districts in the state, different challenges, different issues, different student bodies, different considerations across the spectrum. And that's why we're not getting in their way in terms of making those local decisions. We just want baseline considerations to be met. And that's why we put out, after FDA full approval, our policy. With that in mind, there are a few exceptions. There's been a few exceptions on counties and sheriffs throughout this pandemic. It's part of the work we do.
Are there any repercussions, though?
Well, health rules are health rules. The rules are the rules. If you don't vaccinate for measles, mumps, you don't vaccinate across the spectrum. There's well-established rules that go back decades, many decades. They're not dissimilar to the rules we're applying. And so all of these folks know that well. Their eyes are wide open. And everybody has the freedom to make their choice. But choice is often, it's not the freedom to do something, it's the freedom from consequences as well. And so there'll be, as there was with counties, we send letters. We work with them. We try to address their anxieties, concerns. The vast majority, we're able to work together and figure out. I am absolutely confident the vast majority will figure out, in this case, if there continues to be a problem. And I'm not going to color in the exceptions. I'm going to color in those doing the right thing.